With that, I would like to invite Viveca Martinez from the Health and Human Services Commission to join me here on stage. We are going to take a few minutes this morning to talk about our current legislative session. All right, so as everyone is probably aware, our legislative session has kicked off. It kicked off on January the 8th, and it's actually going to end, the regular session will end on May 27th. As some of you may recall, during the last legislative session, we actually had a special session that ran through the summer in which there were specific items that our legislator addressed, and one of those items was actually maternal morbidity and mortality. Just wanted to kind of give everyone kind of a general overview. So through Martin Luther King Day, 1,400 bills had been filed, and we're actually expecting 5,000 to 7,000 bills to be filed by March. The House Public Health Committee is now going to be chaired by Representative Symphonia Thompson, while former chair Representative Ford Price is going to continue to serve on the committee as a member. Representative Price is now the chair of the Calendars Committee, and that plays a significant role in bills coming to the floor to be voted on by the House. The Senate announced committee assignments just before the Martin Luther King holiday. Senate Health and Human Services is now going to be chaired by Senator Lois Kolkhorst. As y'all probably know, Senator Kolkhorst authored and led the efforts to pass Senate Bill 17 during the last session, and that is the bill that enabled DSHS to really implement statewide our maternal safety initiatives that you've heard about. And then Senator Charles Perry is going to serve as vice chair of that committee, and there are several freshman senators that are going to be joining that committee this session as well. This is a snapshot of some of the bills that we're following within my division. So in community health improvement, we're actually tracking 37 bills. These are not all of them, but these are just some of those that have impact on maternal and infant health programming. As you can see from this list, there's topics thus far that include breastfeeding and expressing breast milk, postpartum depression, neonatal abstinence syndrome, and maternal mortality. There are 3 that are here on the screen that are relating specifically to breastfeeding. You'll see also House Bill 253 is related to a strategic plan to address postpartum depression. And what this bill does is it requires the Health and Human Services Commission to establish a 5-year postpartum depression strategic plan to improve access to postpartum depression screening, referral, treatment, and support services. Also of note is Senate Bill 436, which is looking at statewide initiatives to improve maternal and newborn health for women with opioid use disorder. And this bill actually directs the Department of State Health Services to work with our Maternal Mortality and Morbidity Task Force to implement an initiative to improve the care of mothers with opioid use disorder. And then House Bill 1111 really has multiple components to it. This was, I believe, released earlier this week, or filed earlier this week. And there are different components that we're looking at right now. One is around telemedicine services, as well as piloting a pregnancy medical home, creation of a newborn screening preservation account, expanding the scope of data collection for the Maternal Mortality and Morbidity Task Force, and then finally directing the Department of State Health Services to implement a high-risk maternal care coordination program. As Dr. Ollier just mentioned, the Department of State Health Services did put in an exceptional item to expand our programming related to maternal health and safety, and this really allowed us to look at 4 things. One is to expand the work that we're doing around Texas AIM. Number 2, look at developing a high-risk care coordination pilot. Also developing and looking at screening tools and training providers on that, and then finally enhancing really our public awareness campaign around maternal health and safety. Both the House and the Senate have released their base budgets, and just wanted to kind of share a little bit of information about that. These were both filed a couple of weeks ago. Both fund the Department of State Health Services at around the same amounts from last session, and that's about $1.6 billion with around 3,200 FTEs. The House is going to be the authors of the budget bill for this session. On the House side, some of the maternal and infant health funding includes funding to support the implementation of X-linked adrenoleukodystrophy to newborn screening, as well as $7 million for our maternal health and safety initiative is included in that House bill as well. And then all other maternal and infant health initiatives are funded at existing levels. For looking at the Senate-based budget, the budget did not include the funding for XALD or maternal health and safety, but all of our other maternal and infant health initiatives are funded at existing levels. And so with that, I'm actually going to turn it over to Viveca to talk a little bit more about what they are seeing at the Health and Human Services Commission.
Absolutely. Thank you very much, Dr. Hall and everyone here. I did want to touch just real quickly, which button do I use to go forward? This one? Did it work? It's not working. Okay, there we go. So I did want to introduce myself just real quickly. I'm Viveca Martinez. I serve as Deputy Associate Commissioner for Family and Social Services out at the Health and Human Services Commission. And, you know, I only have 4 slides that we're going to go through today. The Health and Human Services Commission has submitted, you know, its legislative appropriations request, and things are fast and furious back at the commission as we analyze what has been released in the House and the Senate versions of the base budgets. But before I go into that, I wanted to touch, because it's rare that we get an opportunity to come out and to talk to all of you. And I was thinking last night just a little bit about the presentation of legislative session, and I think sometimes there are folks who are intimately aware of the importance of how that plays out on our everyday lives versus others who struggle a little bit to really see the direct connection. Every one of you has a direct connection to the legislative session and the results that come from that, because all of you are working on really important work that touches on a lot of decisions that are made at HHSC and at the Department of State Health Services. So, you know, we come out here as representatives of the agency, and I'm really keying in on a lot of the things that are spoken in the hallways, you know, after we get together after the actual sessions, the comments that y'all make, and the information that you share. And the reason that we really focus in on that isn't just because of session, and it isn't just because of how that might impact a program directly, but it's also because we see ourselves as multipliers. When we're talking to you about something that may not feel directly directed or connected to the thing that I'm working on, I guarantee you that when I go back to HHSC with its 40,000 employees, there's at least 5 people that I'll talk to and say, you know what, I met this amazing person at this conference, I should connect you with them. You guys should really talk about whatever it is that the work is that you're both connected to. So please know that your attendance here and your active participation and the way that you engage with the speakers and with each other, you just have no idea how that impact can really resonate all the way through to the program folks. So, and I, of course, am always humbled to just be here and listen to you all, because that really helps me to expand my own knowledge and take it back to our teams and see how things are working on the ground. So thank you for giving me a second to just share that with y'all, because I am extremely appreciative of being here. So I think my button has a little bit of issue. Maybe and maybe it doesn't. So we have a saying, and it says, you know, be who you are, find who you aren't. So who are we? We are HHSC, and we are responsible for the overall delivery of health and human services across the state. HHSC has more than 200 programs, and it employs approximately 40,000 FTEs. Our operating budget as of last year exceeded $71 billion. So we only touched on some of the more major programs, but obviously with 200 programs, there's so many other programs that feed into these and work separately. But some of the major programs that we administer are Medicaid, Children's Health Insurance Program, TANF, the Temporary Assistance for Needy Families, the SNAP, and then other direct client services. In my shop, I'm directly responsible for the Healthy Texas Women Program, the Breast Cervical Cancer Services Program, and the Family Planning Program, as well as 5 other programs. In terms of this session, our legislative appropriation request did total out at $77.3 billion, but we have an additional $6.5 billion worth of exceptional item requests. And so the folks that are back at HHSC right now, they're working through some of the specifics of marrying those up with the introduced versions of the base budgets that have come out. We do have a total of roughly 40,000 FTEs that we're looking for, again, to ensure that we're able to sustain the programs. And then an additional 1,000 FTEs are being requested as part of those exceptional item requests. And for some of you who are tracking it pretty closely, we'll be hearing, we will be presenting next week at the Senate Finance Committee. And so I think that's running for 2 days. I believe it's Wednesday and Thursday. So if you'd like to tune in, just go to Texas Legislature Online and you can get directly into those live feeds. So for the Women's Health Division, the 3 programs that I just talked about, we're actually tracking over 30 bills right now. I know that the team called me yesterday to let me know another 11 bills came our way, and we just kind of go through those, see which ones relate to us, and then we determine which ones we'll continue tracking. But these are some of the high-level themes that we're seeing right now. We're seeing a lot of bills that are coming through to look at extension of coverage under Medicaid. There's various time frames in which some of those bills are being introduced, and these bills right here, they actually, some of them have companion bills also that are filed with them. We're seeing bills coming through that are trying to address payments for the LARCs, also how we might be able to transfer unused LARCs to other potential clients. And then we are seeing some additional bills related to the auto-enrollment features for some of our programs to try to ensure that we're continuing to try to feed into a seamless kind of continuum of care. And then right here, this is actually our last slide that we're presenting as part of this presentation. And what we wanted to do is make sure that you all were aware of some of the reports that were issued this last year. The legislature, as Dr. Ollier discussed earlier, I actually just finished reading that report for a 3rd time, the Maternal Mortality and Morbidity Task Force report. And it's a really well done report. I don't see her out there. She may have slipped away. Where are you? Oh yeah, there you are. It was, and I know it wasn't only you, but a lot of folks contributed to that. But it's a riveting report, and I'm serious about that. It was an incredibly well-written report that had a lot of great information. And I would encourage other folks, if you haven't had an opportunity, you can go to the website at the bottom and access any of these reports. But each of these reports are legislatively driven. And so the top report really talks about the women's health programs, the savings and performance. So there's a lot of information in there about the overall trends of the women's health programs that are outside of Medicaid and touches some on those in Medicaid. Talks about our auto-enrollment features. We also have the Better Birth Outcomes Initiative, and then the LARC strategic plans and contraceptive data is also in one of those reports. So if you have any questions, I'm here most of the day. I would welcome anyone coming and exchanging with us and letting us know if there's anything that you'd like us to take back to HHSC. And that's about it. Thank you.
And we have time for questions now. Thank you.
So this is actually for Dr. Ollier, but I'm going to tie it to what you talked about. Okay. So because over 50% of women are on Medicaid who deliver in Texas, this ties back to finances. We were talking about maternal mortality and preventable, or ways that we can reduce preventable maternal mortality. So when I added up infection, sepsis, thrombotic PE, and amniotic fluid embolism, about 27.4%, and then hypertensive disorders, cardiovascular disease, and cardiomyopathy were about 32.3%. And while we can't attribute all the first group to cesarean section, the cesarean section rate in Texas is 35%. And one way that I see for something that people can do without the state of Texas being involved in your own practice, in your own hospital, would be to increase VBAC rates. So our VBAC rates in Texas are about 8.6%, and a shout out to Ben Taub for 32%, and UNCM Lubbock for 31.9%. So that's something we can do on a personal level to help reduce maternal mortality. And then also to the infection and sepsis, as a former ICU nurse, there's so much that goes into sepsis protocols and training that I would just empower people to reach out to those intensivists and figure out what they're doing for their sepsis patients.
Thank you for that comment. Any questions for us? All right. Well, seeing none, we are both here for the most of the day today, so please feel free to reach out, and I will turn it back over to Nagla.
Hello? Okay, good. So we're going to take a 15-minute break. If you can be back here at exactly 10 o'clock, we have our very special speaker, and Stacy Stewart from March of Dimes. She's the president of the March of Dimes. So I just wanted to give a couple announcements too. Our lunch today is going to be at the Tejas. There's a group of folks who were contacted earlier for a meeting during that time on Muse, QI Muse. I just wanted to let them know we're going to be in room 108, if they would grab their lunch and be at room 108. If you did not get your parking permits, if the parking passes, if you can go to the registration desk. If you need anything else, including lactation room, etc., please go to the registration desk. Thank you very much.